Welcome to our Primetime Alive program on longevity, health, and happiness. I'm Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley Medical Center. As a reminder, if you want to sign up for an upcoming program or view upcoming programs or sign up to join Primetime Alive, you can go to mgmc.org/PTA. All right. Our presenters today are Dr. Peter Martin and, as of yesterday, Dr. Barbra Brottman. She just passed her, what do we call it? Defense yesterday to receive her PhD. So we get to add doctor in front of her name. Okay, so Peter Martin is a university professor of human development and family studies at Iowa State University. His research interests include longevity, personality, stress, coping, and well-being. Dr. Martin has studied longevity in the United States, Germany, India, and Japan. He has served on a number of community boards, including the Iowa chapter of the Fulbright Organization, the Healthiest Ames Initiative, Heartland Senior Services, and the North Crest and Bethany Life communities. Other than his professional activities, Dr. Martin likes to work in his garden and spend time with his children and grandchildren. And he is a very seasoned professional here at Mary Greeley, giving programs. I don't know how many years it's been now, many, many years, but every couple of years we bring him back and he's always willing to come. So we can add seasoned Primetime Alive presenter to that list, okay? And then Dr. Barbra Brottman is not a doctoral candidate anymore, is what I had, but she's in the gerontology program and human development and family studies department at Iowa State. Her research focuses on older adults with dementia, their family caregivers, and programming for older adults. When not focusing on her research, she enjoys exploring new restaurants, being with friends and family, and being outside with her partner and their two precious dogs. So we are going to start first with Dr. Martin, so please welcome Dr. Martin.
Thank you, Vicki, and thank you for inviting me back. It's always good to be back at Mary Greeley and at Primetime Alive. The fact that you keep inviting me back must mean I haven't answered all your questions yet. And I'll try a little more today. So I'm very happy to do that and to talk about my favorite topic on longevity, health and happiness. I've worked on my research and my teaching for more than 30 years now, and I still haven't figured out the secret of longevity. So I'm still after it. We'll have to see. I would like to talk about a few critical issues that are related to longevity. And most of these really do seem to indicate that these critical issues that I mentioned here tell us whether people live a long life or not. But perhaps more importantly, once you live to 80, 90, or 100, you want to know, what is life like? What is your health like? What is your functional capacity like? Health behaviors are important. And then we'll ask Barbra to tell us a little bit about pets and healthy aging, and finish up with mental health and happiness and cognitive health as important aspects too. Of course, a lot of our longevity depends on the kind of resources that we have, and I'll hope I'll get to that at the end of our talk. But before we get into these critical issues, I will talk a little bit more generally about population changes, an aging world. I'm sure you've heard about it, but just to give you an update on that. And then specifically about centenarians, people who are 100 years and older, which is always a wonderful opportunity for me to discuss and talk with people at this very, very old age group. But I want to start out with a favorite picture of mine here by Lucas Cranach, who called this picture, or named this picture, the Fountain of Youth. And that is really what this presentation in many ways is all about. Painting done in 1546. And we all wish it was so happy. Would be so easy. As if you are ill, if you're frail, all you'd have to do is to go into this spa, into this bath, and then on the other end you come out as a healthy, rejuvenized person. And that's not how it is, unfortunately. We don't have that. Maybe Mary Greeley gives us a little bit of that. If we come in here, we come out healthy again. But in my research in other countries, I found two particular places that may be coming close to this fountain of youth. And one of it is in Japan, which they call onsen. And these are springs out in nature. And you don't see any people in here right now because they're usually naked and they don't like to be photographed. But this is an onsen where people just go into this hot spring and really do feel relaxed. And I have seen many Japanese and talked with many Japanese who do this almost every week just to relax and get less stressed. So maybe this is a little similar to Lucas Kranach's perspective. And then we have a similar perspective in Finland. As some of you may know, the Finnish sauna does the same sort of thing, except it's not water, but it's a very, very hot room, a steamy room. And then I guess Finland being a very cold country in the winter, you jump around in the snow and get cooled off. So that may be another recipe of longevity. And Finland, as some of you may have seen in the news lately, has been rated for several years now the happiest country in the world. So maybe this is it. Maybe we all should take a sauna more regularly in order to understand which direction we'd be going. Let me talk a little bit about population changes. When we started to research centenarians, it was still a group that was not very common in the United States. And we're not only looking at centenarians, but if you look at people in their 80s and 90s, or what we call the oldest old, now defined as those 90 years and older, we should recognize that this is the fastest growing segment of our population. Faster than any childhood group, adolescence, adult group. And you see this here in this graph. Again, you don't have to know the exact numbers in here to see. These are people that are 90 years and older, 90 to 94. These are 95 to 99, and these are the centenarians. And really, it is this group of all of these three groups, but particularly the one between 90 and 94, that is the fastest growing segment of our population. It's a rapid increase, and we can expect more than 76 million people worldwide that will achieve this age. And so it is something that governments are now paying attention to, and that we all need to pay attention to. We need to prepare for the fact that 2030 is just around the corner, and these 20 years alone will see this dramatic increase in our oldest old population, which is one of the reasons why I got interested in this. You can also look at life expectancy, and there have been some recent changes in here. Japan, for many, many years, had been the leader in life expectancy, as you can see on this graph. But Hong Kong now has surpassed this, at least for women. The average life expectancy is 88 years. So that means that for every newborn today, half of that population can expect to live at least to 88 years, if not longer. And Japan is doing pretty well too with 88.09. You can see it's almost close. Actually, for men, Switzerland has the first rank right now. Men in Switzerland can expect to live on average to 82 years. And that is certainly higher in most other countries. The only really bad news I can share with you today is that here in the United States, we are losing ground. We are now 46th in the world in terms of life expectancy. And we used to be in the top 10, in the top 5 of all countries. But now, really, we are losing ground. We still, for many years, had increased in life expectancy. As a matter of fact, the last 2 or 3 years, even starting before COVID, we had lost in life expectancy in the United States. Of course, COVID had done its part too, unfortunately. But even before COVID, we've seen an increase in mortality in the United States at all ages, adolescents, certainly throughout adulthood and later life. And so we need to look at other countries, particularly European countries. We see Switzerland, we see Italy, Spain, and other European countries that are doing so much better now than we are doing. And so that's why I travel around the world to figure out where are we and what do we need to do. But in general, the message really is that population aging is a global phenomenon. every country increases in the aging population. Again, the pandemic has put a little bit of a stop to that, but we are getting right back to where we were before COVID. Virtually every country in the world is experiencing growth in the size and proportion of older persons in their population. So that is something certainly that we need to pay attention to. And as I indicated, my particular interest is about centenarians, people 100 years and older. And I showed you an earlier graph, but if you just look at centenarians, we can get a better picture here also worldwide. The increase of centenarians sort of started in 1950. Really, before 1950, it wasn't worth talking much about centenarians because there were just a few people here and there that got to be 100. But then we have seen sort of a steady increase, again, all the way up to 2030. Now we're seeing a change in that slope and a tremendous increase from 2030 to 2050 also in centenarians. We have to prepare for that as well. What accounts for this dramatic increase after 2030? Well, some of you may know it's me, it's us, the baby boomers, who are so strong in numbers. And of course, they've now all reached older age, or just about all reached older age, and they're getting older too. And so that strong demographic group will account for this dramatic increase here in centenarian population. So in 2050, we expect more than 3.1 million people that are 100 years and older. In 2014, we had estimated about 72,000 people in the United States alone who are 100 years and older. We are waiting for the 2020 census data, but as you may know, there's been a delay in calculating all of that and in providing documents. I was told that sometime in May we will get the data on age groups. So I'm looking forward to get an update. The latest estimate is that we actually now, almost 10 years later, at anywhere between 90,000 and 100,000 people in the United States who are centenarians. Here in Iowa, the 2010 census counted about 750 centenarians. I wouldn't be surprised if we don't reach the 1,000 mark of centenarians here in Iowa by the time that we get the new census data. It is also centenarians who are very, very fast-growing segment of our population. So, who is the oldest person? If you have been or heard one of my presentations before, you know that it is a woman in France who got to be the oldest person in the world, 122 years and 164 days. So think about being 100, and then there's another 22 years. That's another fifth of your life that you're adding to it. This is a new set of pictures that I found, and you can see sort of the timeline of her over the years. You know, you can see how there's, in my view, even more character coming to this face. I love her pictures, just to see what happened over time. She once said, if you don't do anything about it, don't worry about it. That was her secret of longevity. And she recommended laughter as a recipe for longevity, and she joked, God must have forgotten me. She had a good sense of humor. Actually, I remember one of my colleagues in France would visit her every year and would give her a physical. And I think she was 119, 120 when she gave her a physical, and he said, Madame Calment, you look fine to me, and I hope to see you again next year. To which she answered, well, I don't see why not. You look perfectly healthy to me. So she had a very good sense of humor. Well, if you have seen one of my presentations before, the good news is there's always one slide that, I don't know, it's good news, but that's always very, very new, because I'm sharing with you who is the currently oldest person. And that changes very quickly, unfortunately, because you don't stay to be the oldest person for usually very, very long. But right now it is Maria Brañas Morera from Spain. We haven't really had somebody from Spain be number one, but she's 116 years old. Ways to go until 122, but still 116 is what we call a super centenarian. And she also looked or shared her secret of longevity. So I'm always looking for that. She said, order, tranquility, good connection with family and friends, contact with nature, emotional stability, no worries, no regrets, lots of positivity, and staying away from toxic people. That is what she credited her longevity to be to be accounted for. Well, really, this covers it all. A lot of what I was going to talk about today. We talk about family connections. We'll talk about emotional stability, not worrying, being positive. I could finish right here and say, you've got it. This is it. Okay. She actually mentions more than one thing. And notice she doesn't mention genes. We'll talk about genetics a little bit later, but genes is rarely what I hear centenarians say is what accounts for it. She did think it is a lifestyle. Fusa Tatsumi from Japan, also 116, just a little bit younger than our rank holder here from Spain. And then we have somebody from the United States in rank number 3, Eddie Cesarelli from the United States, 115. She's from California and also still going very, very strong. Actually, turns out that Maria Morea from Spain also spent some time in California. She came to California as a child, I think just half a year old or 9 months old with her parents. They went to California, and then 100 and some years ago, there was a lot of conflict in Spain, as some of you may know from history, and so the family went back to Spain when she was about 6 years old, and she stayed in Spain ever since. But California now twice in the news for rank number 1, and at least for a little bit, early childhood influences number 3. So a lot of good advice from centenarians that we can see in here. I always like to start out in my own research by really asking very straightforward, mundane questions. And when I meet centenarians, one of the first questions that I ask is, what is it like to be 100? Don't necessarily want to know what got you here, but now that you're here, what is it like? And this is one example of a centenarian who says, oh, it's pretty gracious, I enjoy it. I don't feel like I'm 100. And I hear this a lot from centenarians. And perhaps one of the surprising findings that I always like to share is this finding in here is when I ask this, I also ask people, well, is it more positive? Is it more negative? Or, some positive, some negative. And you can see that the most likely answer here, half of everybody I've asked is saying being 100 is positive. Not only positive, it's very positive. And then there's another group of people, a little bit more than 40%, who tell you, well, it's sort of in between. There are good things and there are not so good things. Maybe I can see as well, maybe I can't walk as well, but I have family and I have people visiting me. And the people are also nice here in this care facility. And notice, and that's perhaps the most surprising factor for me, it is a very small number who say, well, this is very negative. I wish I died tomorrow. There are some, 5%, but really it's the smallest number. So I think this is a good news, and perhaps for us it was a surprising finding that most centenarians do think it is good to be 100 years or older. We also ask them, did you ever expect to be 100? And most everybody says, no, I had no idea. I did not expect it. I didn't plan it. I didn't prepare for it. It just happened one day at a time, I guess, is one way of saying this. But let's look at one of the first critical issues. Of course, one question that we always have is, what is health like? What is your physical health like if you are 100? This is a Japanese centenarian. You can see 104 years old when I took this picture. When he was 100, he decided to start every year that he still felt able to do a world tour. He was a physician, he had the resources, and so he'd go on a plane and he'd travel the world. And 1 year when he was 104, he was on his world tour, and he visited us at a conference, and of course he was the star of the show, as you can see in here. This is at the conference center. And if you ask centenarians, how do you rate your own health? How is your health? Is it excellent? Is it good? Would you rate it as fair or as poor? Here, too, perhaps the surprising finding is that most centenarians rate their health as either good or excellent. You can see these lighter shades is Japan, or work in Japan, and then the darker one is in the United States. And you can see that that most American centenarians whom we have interviewed would say their health is either good or excellent. There are some who say it's fair, about 20%, but very few people who say their health is poor, or they consider their health to be poor. And you can see in Japan it's actually a little bit more skewed. More people say their health is excellent, almost 60%, and nobody who we talked to said their health was poor. There were some who said it was fair or good, but it's really an important finding that in their own view, their health is really, their physical health is really considered to be very, very good. Of course, with the work that I've done with centenarians in Japan and in the United States, I'm often asked, well, are there any differences? So we've published this in several papers, but I've summarized it here very briefly to say that the Tokyo Japanese centenarians had a better BMI, body mass index. So their weight was less than centenarians in the United States. And I'll talk about that a little bit more later. But centenarians here in the United States had several important advantages too. They had better blood pressure readings, their cognitive status was better, their memory functioning was better, they had fewer diseases, and they had fewer hearing problems than the ones in Japan. And then US centenarians compared to Japanese centenarians were also less anxious, they were more extroverted, more outgoing, and they were more conscientious, reliable, they took care of their health in different ways than Japanese centenarians did. So we indicated before the advantage of people in Japan is that they had the highest longevity, but maybe at a price. We have perhaps not quite that many centenarians per population when compared to Japan, but the overall health does seem to be better. So that's another piece of good news for all of us to think about. The one thing that I wanted to really address is then not so much the physical health. If you talk about organic functioning, your heart, your lungs, all of that seems to be fine. Cancer, you probably wouldn't have survived to 100 if you had cancer or diabetes or other diseases. But what really seems to be more of a problem is what we call functional health, your daily functioning. And this is depicted in this graph in here, where we actually compared 3 different age groups in our work. Centenarians, the 100-year-olds, this lower graph, octogenarians, people in their 80s, and then people in their 60s. And we asked them, can you do these things with or without help? Can you talk on the phone? Can you walk? Can you go shopping? Can you do your own cooking? Can you do your own housework? Can you take care of your own finances and your own money? And what these 2 graphs of people in the 60s and 80s say is that almost 100% of people whom we interviewed said, yeah, we can do this. We don't have a problem with these. A little bit less for people in the 80s already, but by and large, more than 80, 90% of everybody said, I can do all these things, and most of those without help. When you, however, interview centenarians, you would see a major drop, a major gap. We don't have 100, 80, or 60% of centenarians saying that they can do this. Maybe the best still is being able to use the phone, but the worst is being able to walk. Only about 12% of centenarians say they can walk without help. Shopping is more of a problem, cooking, housework, taking care of your finances. And so this is where we are as gerontologists working on ways in which we try to improve this lower graph and push it up so that people can walk longer into their life, that they can still take care of themselves, that they can do their own housework, that they can take care of their own finances. And that's what a lot of our work is about. And you can see in here that we talk about even the changes over time. Here again, the 3 age groups. Centenarians is the lower graph. Then we have people in their 80s and people in their 60s. And these are these activities of daily living. And how many of those out of 14 can you do at baseline, our first measure, and then 20 months later for our centenarians, we couldn't retest them after that, but then the younger age groups all the way 5 years later. And you can say in your 60s, 5 years later, there's not a decline. You can continue to do these 13, 14 items of activities of daily living. People in the 80s, you see already a little bit of a decline. Our centenarians already start lower at the first measurement point, and after 20 months, you see what we call an accelerated decline. So when we talk about health and longevity, it's really not your organic health, your blood pressure, that counts as much, your heart, your lungs, other organs. It really is your functional health that you need to work on, and that often can be done through health behaviors. And that is something that really seems to be a crucial factor, is that, yes, we do need to take care of our physical, organic health, but perhaps even more so of our health behaviors. And here I like to quote by Mickey Mantle, whom you may know, a baseball player, who said, "If I'd known I was going to live this long, I would have taken better care of myself." Now, if you know Mickey Mantle, he had parents who were alcoholics and died early, I think in their 50s, and so he became an alcoholic. He lived a little longer than his parents, but he really was serious about this. It wasn't just a joke. And really, this sums it up. I don't have to say much more about health behaviors. This is where the problem is when we talk about functional health and health behavior. If we just could control those three things, smoking, overeating, and inactivity, we would all do a lot better. Smoking, poor diet, physical inactivity are the causes of 35% of US deaths. Every third death is because of one of those three reasons. And if you could control those, we'd do a lot better. So just a couple of minutes about all of this. This is not news for you. The next several slides, you've heard all of this. You've read it in the news. But I can't skip over those because these are very, very important. Smoking certainly being the number one aspect of it. And the good news is in here that over the years, every country in the world except for one has decreased smoking rates. United States is somewhere here in the less than 40% of people smoke now compared to 1990. And Denmark was the greatest decrease in here. But, every country doing reasonably well except one, and that's Russia. And there may be specific reasons. Of course, these are not recent data with the conflict that we've seen in Ukraine, but it is important. So that's the good news. And the not so good news is that smoking rates are still very, very high. I have three countries in here, the United States, France, and Japan. And smoking rates, with the data that I have looked at, is that 25% of all adults are still smoking. In France, that rate is even higher, with 35%, and it's somewhat lower in Japan. Now, if you follow the news, you might have seen just yesterday or the day before that there was a quote from the CDC that smoking rates in the United States is at about 11%. Now, that's a lot better than 25%. Now, again, sometimes you get data from different sources. I usually use world comparisons in here. But if it really is at 11%, we are doing even a lot better than this, which is great. Because smoking may cost you 17 years of your life if you're a regular smoker. And so if there's one thing that people can control, then certainly is that. It's not easy to quit smoking, but it is certainly possible. Smoking rates that we see in here, if you ask centenarians, 82.5% of Japanese centenarians say they've never smoked. And that's a generation that did smoke a lot, right? And less than 1% of Japanese centenarians are smokers. There are some who survive even though they do smoke. In the United States, of all centenarians, we studied 72% said they never smoked, and it's only less than 3% of centenarians who are smokers. So again, smoking rates among centenarians are very low and have always been lower than the rest. With obesity, the other part that certainly is important is we see in Japan that there's a very, very low prevalence of obesity as measured by the BMI. Only 5% are greatly overweight. In the United States, we are now at 36.5% of the population. These are not centenarians, these are adults. And certainly it's very, very excessive, and that is a challenge for us here at Mayo Greeley, I'm sure, but certainly in gerontology to try to control that. I'm not going to go through that a lot because you've heard this. The Mediterranean diet is, of course, what helps with a good diet. The Okinawa diet is a specific Japanese diet, and I've sort of combined those to see what overlaps. Not everything is Mediterranean, works in Japan. I don't see too many red wine drinkers in Japan, for instance, and not everything that works in Japan or works in the Mediterranean. There's not a lot of sushi that they eat there. So we have to see what overlaps. Eating a plant-based diet, limiting sugar grains, eating more soy and other legumes, herbs and spices instead of salt, enjoying meal with family and friends. There's a social component in here too. And perhaps the most important lesson from Japan is what they call Hari Hachibume. Eat only until you're 80% full. I'm going to tell you a secret. I'd be happy if I stopped at 100% sometimes. I like to eat, but the Japanese say, no. And everybody, I ask students in Japan, they say, yeah, my parents told me, don't eat more than that. And you can see the caloric intake in selected countries is just very, very high and increasing. We are, again, the leaders in here, but all countries, certainly China, England, and even India has seen a particular interest in here. So I'm skipping that. Physical exercise, again, I don't have to tell you how important it is, other than to say that if inactivity was decreased by 10%, then 530,000 or 1.3 million deaths could have been averted if people just walked more, gardened more, would do more running. And certainly we know the benefits of physical activity. It increases your good cholesterol. It prevents disease such as diabetes and high blood pressure. There are mental health benefits, and there are also financial benefits, not just for yourself, but for this country. In the United States, increasing physical activity could reduce the direct medical costs by more than $77 billion annually. $77 billion, that's a lot. And then inactive women, a study on women 45 years and older, had at least double the healthcare costs of their active counterparts. So it is also a financial issue that we need to consider. So we've talked about physical health, functional health, and health behaviors. Of course, one of the questions that we're also interested in is, what about pets and healthy aging? Is there a way that pets can help us? And that is one of Dr. Barbra's specialties. So I asked her to come in and tell us a little bit about the influence of pets and health. And so I'll yield the mic for her for a little bit.
Well, thank you, Dr. Martin. And hello, everyone. I am Barbra, as you probably know now. But I wanted to talk with you all a little bit about some of my interests, one being that I have had for many years. I never say I'm the firstborn, I'm the thirdborn, because my parents had 2 to 3 dogs at a time. But some of the work that I've done throughout my time in graduate school has looked into the relationship and understanding of how pets influence older adults. So there are approximately 67% of all households that have a pet in their house, and they continue to increase. Pets can include dogs, cats, birds, rabbits, ferrets, rats. I could probably go on for hours about that. Additionally, animals have been used in therapy settings, continuing care facilities, and hospitals to enhance the support in many different populations. So what's the name behind this such support? Well, researchers have provided an understanding of the human-animal interaction that specializes in the understanding of how our relationship with animals can influence both us as humans and the animal's health. Specifically, this relationship has been shown to impact happiness, decrease loneliness, enhance physical activities, social engagements, among some others. So HAI, the human-animal interaction, is still growing among research, and it's pretty new in the field. So what do pets influence? Literature has shown that pets are a key component to healthy aging and impact cardiovascular health and depression and anxiety, loneliness, social support, physical health, and quality of life. And some of the strongest research within HAI and health outcomes have focused on cardiovascular health and the adaptive stress responses. So pet ownership has been associated with lower blood pressure, lower heart rate, faster recovery during mental stress, as well as long-term survival in patients, specifically those who have experienced a heart attack. As for depression and anxiety, the role of animals have helped to mitigate these concerns and experiences. Research has also seen a reduction in depressive symptoms when animal-assisted activities are incorporated into care facilities. And people experience fewer anxiety symptoms among those with Alzheimer's, individuals who are hospitalized for heart failure, and living in long-term care facilities. So although I am discussing research within these realms, I think it's important to note that there's still a lot for us to learn regarding the experiences and individual experiences among different environments. So these interactions provide social support for older adults and thus reduce the risk of loneliness. Older adult pet owners have been less likely to report being lonely as the pets act as a catalyst for human social interaction. In particular, people focus on the emotional bond that they have as an important aspect to the experiences with pets. And pet owners have also indicated improvements in their quality of life, their mood, and as well as social interactions. So although pets have helped individuals by being more active with walking and less deterioration in the ability to perform these activities of daily living, such as walking, cooking, and bathing, animals can be a fall risk. There have been increases in falls among some owners. And lastly, after individuals retire, they have been shown to have a smaller decrease in life satisfaction. But I think it's all dependent on the individual. If you like pets, you might have better life satisfaction with one, or not. So a specific project that I worked on was looking at the association between older adults with self-rated health as well as their pet attachment. So among a large sample of individuals, they were asked to rate their health with being excellent, very good, good, fair, or poor. And then for pet attachment, we conceptualized this within 5 different questions of, do you consider your pet to be a friend? Do you talk to your pet? Would you say that owning a pet adds to your happiness? Do you talk to others about your pet, and do you often play with them? So although pet attachment was not found to have an impact on self-rated health, among those pet owners, income, gender, education, participation in moderate physical activity, so 15 minutes 3 times a day, and depression did significantly influence one's self-rated health. So there are some different programs that I have looked into and worked with some individuals in my time, specifically at the Virginia Commonwealth University. So they have a whole institute related to HAI in their Center for Human and Animal Interaction, and they do training for different organizations. They provide education on how to start a center, how to start a animal-assisted activity within your community, as well as provide services in the community. And you can also become a Dogs on Call team. Specifically, that's in Virginia, but maybe we'll make one here in Ames. And then as well as they consistently are doing research within the center and partner with many different researchers, foundations, and organizations across the world. And Tufts University also has a HAI center. So animal-assisted activities are also another way to provide an increase in life satisfaction and decrease depression. So it's common to bring in dogs and their owners into a nursing facility, into a hospital, as well as a library. We see some on campus right now with finals starting up for our students. So with all the positives, there are some challenges and considerations to be made. More research is needed within HAI, and I want to preface by saying, please don't go out and buy a dog or a cat or an animal. They do require a lot of work. And that is all I have for you at the moment.
Well, it's given me a little bit of a break. And we are so proud of our graduate students that I've decided I'll have to showcase them and bring them with me. So we're proud of Barbra and other graduate students. We have now at Iowa State a doctoral program in gerontology, and she is one of the students now graduating from that program. So we're really doing a lot of good things. I want to finish up with just a few more slides on the mental health aspect of it. Nice transition. We know that dogs increase, as you've heard, and cats and animals in general. general, our mental health too. I'm glad to see that places like Bethany Life, you've heard I serve on the board, now has a dog resident there who runs around all day, and so does Northcrest has a dog, Green Hills dog visitors, and it does a lot. It really is important for people. But there's more to mental health. So again, starting out with the question: are you as happy now as you were when you were younger? And again, we have two country comparisons. This time, I'm showing you a comparison between the United States and Germany, and you can see the majority of people say yes. 52% in the United States say yes, I'm as happy as these are centenarians as when I was younger. 38% say no, and certainly we look at our lifespan and we may say, well, that was my happiest time. Doesn't mean that you're depressed when you're a centenarian. 8.7% there are uncertain, but most centenarians are just as happy, which is really good news. We looked at a large new study called the Health and Retirement Study and asked also the same question, do you feel happy right now? Do you enjoy your life? And again, these are centenarians all over the United States, and almost 90%, 86.4% say yes, they enjoy life. 82% say they feel happy. There are some, and again, we have to pay attention, like in any other segment of our population, people who are not feeling happy. But it is not the case that as you reach 100, everybody or the majority of people do not feel happy anymore. What does seem to be a problem sometimes is what I want to show in here, and lots of numbers. And the message I want to get out in here is we ask sort of lots of mental health questions in here. The one that stood out is the question of do you feel useful or useless or worthless? And that was the question that was the one mostly endured. Not so much do you feel worried or lonely or sad. Those were pretty low percentages. But a third of all of our centenarians that we studied said, I don't feel useful anymore. I feel worthless. And that doesn't have to be the case, because many of them can contribute in ways to the community. They know more about the community that they've grown up in than most other residents. And so that is where we need to put an emphasis on what we call the emotional health of centenarians. We see it also on this slide, actually a very recent study of this national study that I've already talked about. And there are two different trends in here. If you ask people whether they're satisfied with their life, and you see longitudinally, we have studied centenarians over time again, over different time points. And there was, even as you get 100 years and older, an increase in life satisfaction. People say, I'm more satisfied now than I was a few months, a few years ago. But what decreases is the brown line in here is the sense of purpose. It's a different way of talking about being useful or having worth, but to have a purpose every day when we get up. Why do we get up? What's my purpose? Just to sit here and wait for the day to go by? Nobody wants that. And so again, as service providers, as family members, and for our own good, we need to make sure that no matter how old we are, we find a purpose. We find a way to be useful, whether it's to our families or to our communities, or just for our own good and self. We see this again in this longitudinal study that we compared these three age groups. This is, again, these positive emotions. Do you have positive experiences? And if you're in your 60s, over 5 years, there is no change whatsoever. If you're in your 80s, there is you can see the beginning of a decline in these positive emotions. There's less of that 5 years later. Our centenarians already start lower. They only have these 20 months, and you again see this accelerated decline that we've seen in other measures before too. So very, very important aspect to consider is these positive emotions. There's not an increase or decrease in negative emotions. That seems to stay very, very stable, in spite of what sometimes feel about the so-called cranky older adults. They're not. If you find an older, cranky person, they probably have been cranky for all of their lives, or at least a good part of their life. We just didn't notice it because we didn't spend as much time with them. But it's the positive emotions that decline, and that clearly is something that we need to work on as gerontologists. And then the last critical issue to talk about is cognitive health. And yes, there's cognitive decline that we do see in as people move from 60 to 80 to 100. It is trainable, however. And what we pay more and more attention to is what we call cognitive reserve. In other words, it is possible, and there's good evidence, including our own research that I'm going to show you in a minute, it is possible that you can build up a reserve of cognition that comes in handy when you would otherwise decline. Think about your cognitive reserve in the same way that you think about your bank account reserve. You don't want to run out of money, right? You don't want to run out of cognitive reserve either. And we know today that this is also not just genetic. You can build up your cognitive reserve, and this is what it looks like in general terms. And we have shown this in a recent publication in here. It starts with good education. And I'm completely unbiased in saying this. The more education, the better. I'm from Iowa State. But it does show up with our centenarians. They were educated 100 years ago, or 80 years, 90 years ago. And this educational effect still shows later on by doing well cognitively. And of course, you can continue to educate yourself. There are more. Oh, you're here. Congratulate yourself. Today, you're building up your cognitive reserve just by the fact that you listen to somebody. Because whenever you listen to a talk, no matter how engaging or not engaging, but your brain starts working. So your synapses starting to make connections. And that is so important to build up that reserve that I talked about. We also knew that your occupation can help build up reserve. If you have a challenging job, your brain is going to be more involved, particularly if it's cognitively challenging. And if you have sort of I sit here and wait until the day's over and I look forward to be at home and watch television and that's about it, that's not building up reserve. It's a lifestyle, and it's up to you how you want to lead your life. But if you choose a more challenging job, you're building up that bank account, your cognitive bank account, your reserve. And of course, that then goes to an engaged lifestyle throughout your entire adult life. People who are more engaged, who are more involved, who do more things, who volunteer. All of these activities do build up cognitive reserve and then have a direct effect on cognitive functioning. So that's one pathway, from education to occupation to being engaged in life. All of that, people who did these things, the more you were involved in any of these aspects, the better your cognitive functioning in later life that we've shown. The second pathway is a more social pathway, also very effective. People who are more socially engaged over their lifespan interact with other people, either in their jobs or in their families or in their community, also build up reserve. They become more active, particularly physically active, and that also builds up cognitive reserve. So I could show you the data, and I've taken those slides out from previous years where there's a decline in cognition, and yes, there is, but I think the more important news is this, that how much reserve you have is up to you. Just like you practice your body and you exercise your body, you need to exercise your mind, and it does make a difference. So the final note in here is on resources. So we've seen these critical areas of physical health, functional health. We've seen it on mental health and cognitive functioning. But there's also other aspects that can help us build up these resources. You can see the centenarian who love to be, this is in a retirement community, to be in the library because all these resources to read. Of course, now we have computers too, and they are a wonderful resource as well. But really, when we talk about resources, these seem to be three very important resources to pay attention to. One is what we call, and we've seen in our own research, is personality. It's keeping stress levels low and being able to cope effectively. And we have developed what we've called a resilient personality, distinguishing people who can deal with adversity, who overcome these and live a long life. And they tend to be emotionally stable. We heard our centenarian before. She talked about that, right? Don't worry about things. Be more extroverted than introverted, a little bit more outgoing because that gets you out there and interact with other people. Being open to new experiences, and that's sometimes hard. It's so much easier to sit at home and say, well, I don't want to go out today. And yet if you do, you challenge your body because you're moving, you challenge your mind because we're interacting with others, you're learning perhaps new things. Being conscientious so that you have a more predictable life, and being agreeable rather than to fight things out with everybody. Being disagreeable is just a lot more stress for everybody. And so these are called the big five, and they do seem to really be connected to surviving and surviving well, to a healthier and happier lifestyle, as it were. Keeping stress low. And then we do know that people who are what we call active copers. So if you do, we all are confronted with problems from time to time. The question is not, do you have stress? The question is, how do you deal with it? And if you're more of a problem solver and you take it as a challenge and you say, yes, I'll be able to deal with this, you adjust much better, you'll be healthier, happier, and you live longer. Acceptance is another aspect of it. If you can change it through active coping. But if you can't change it, and there are some things in life we cannot change, then at some point you do need to accept it. What you don't want to do is to be what we call an avoidance coper, where you say, well, I'm not going to deal with it, or you even deny that there's a problem, because the problem is not going to go away that way. You have to deal with it one way or another. Of course, we also know that family support is very, very important. And we know that certainly emotional support in the family, giving each other support, and being open to receive support from your children and grandchildren is very, very important. But we also more and more understand that spending time together is important. And of course, COVID made this less possible for many, many older adults. But we have technology that has opened our window, literally and figuratively, to connect to other people and to say, I want to. Can we just talk for a little bit and get together with FaceTime or other modes, Zoom, that you can now much more easily engage in. And of course, helping other family members is important too. They are the ones who can really allow us to function better. Social support in general influences our longevity. It is also important for cognitive function. As you saw in the cognitive reserve graph before, this earlier study in here showed that people who are socially disengaged, no social contacts with family and friends, they were 2.5 times more likely to experience cognitive impairment over a 12-year time period. And so really these lifestyle behaviors are very, very important. Yes, there may also be a genetic component in a lot of longevity, but today we know that genes turn on and they turn off. It's not just that you have a bad gene. If you have it, your task may be to keep it turned off, like you would keep a light switch being turned off if you don't like light. And we think that some of our health behaviors, some of our cognitive behaviors allow us to do exactly that, to keep a bad gene, let's say an Alzheimer's gene, being turned off, or to turn a good gene on at the right time. So there's really a gene environment interaction. We ask people in Japan, in the United States, are there people you can depend on to help you if you really need it? This is the social component that we talked about. And we see that that in both countries there was strong agreement. Yes, of course, I have somebody who can help me. More people just agreed. Very few people disagreed. And nobody in Japan or the United States who have interviewed strongly disagreed that there isn't somebody there. These are centenarians. And of course, as I often say, if you want to become a centenarian, you probably can't do this on your own. And I want to finish up with a very latest slide. We just analyzed the data. Actually, you're the first ones to see this. This particular slide and the findings of this. We looked at the Honolulu aging study, and they now also have centenarians. And we asked, what does it take to make it from 70 to 80? What does it make to make it to 90? And what does it make what does it take to make it to 100? These are people who were already in their 70s when they were started, and then we followed them over these 30 years. And really, there's great consistency across in here. Father's age, these are all men, because the Honolulu study does not have women for reasons I can explain if you're interested in, but there was just men. And father's age at death was a predictor of their own longevity from 70 to 80, but not thereafter. If you made it to an 80, that component was not as strong anymore. But there's a longevity gene that did seem to stand out called FOXO3, and FOXO3 was a predictor of making it from 70 to all these other age groups, so a consistent predictor. Good cognition, people who had better memory functioning were more likely in all these hurdles to make it from 70 to 100. Physical activity was important, less so from 90 to 100. Obviously, it gets more difficult, or you already have your routine, but it was important. The more physically active you were, the more likely it was to make it from 70 to 80. This is not a print. A slightly higher BMI was actually associated with surviving. Now, we're not talking about obesity. The obesity one is a level 30 or higher, as you can see. So it was 23 is the cutoff between what we will try to have as a BMI, and 23 to 30 is considered to be overweight. So being slightly overweight would get you from 70 to 80 and from 80 to 90. We think about those also as some reserves that you might have. Good health certainly was a predictor. Few depressive symptoms. Regular checkup. Being here at Mayo Greeley, I think a very important part. If you had regular physical checkups, you were more likely to make it from 70 to 80, 80, 90, 90 to 100. And again, that makes good sense because you can catch things that may go wrong early on. Not smoking, obviously, had one of the biggest effects. No alcohol drinking actually was also associated with making it from 70 to 80, 80 to 90 to 100. And then high life satisfaction played a role to make it from 70 to 80, from 80 to 90, but not in these other groups. Actually, our 90-year-old sample looked a lot like the centenarians. So if you made it to 90, there were fewer things than before, as you can see. Still not smoking, drinking, checkups, good health, cognition, and that gene that I talked about. But all of that was certainly very important too. So, longevity. We talk about longevity as the social revolution of the 21st century. We think there is no other or very few other issues that are as important for ourselves, for our families as caregivers later on, and for our communities who build assisted living facilities and long-term care facilities, for our society when we talk about Social Security, Medicare, Medicaid. All of these are issues you see in the news all the time. And so we have, Barbara, you have a lot of work ahead of yourself. Okay. The next generation of gerontologists. There are challenges and opportunities. Certainly the population changes that I've talked about, the challenges, but also what we can do to improve our health are physical, functional, cognitive, mental. Those are what we call the critical issues of our time, but there are resources that can help. Our personality, coping, and social support. We can influence our healthy longevity by engaging in more effective lifestyles, more exercise, more nutrition, more support. None of that is surprising to you. What is our challenging task is, if we realize we have to exercise more, we have to eat more, less than 100% of what is on our plate. How can we do that? How can we translate this? So my very last slide here, let a centenarian or centenarian speak. Here's a centenarian I interviewed in Des Moines, and then another centenarian in Georgia. How did I live to be 100? I took one day at a time. So again, centenarians don't have this program that they say, well, you know, I started in my 50s and I designed a program to get to be 100. It's one day at a time. Every day is a gift. And then a centenarian saying, I don't have no magic formula. I just went to work, done my job best I could. The years just piled up. And here again, it's not something that you do, but again, you do live your good life. And that's in this last quote in here. How did I live to be 100? I haven't done anything special. I just lived. But I think these last two words are very powerful. I just lived. So let's all just live. Thank you very much.
Wonderful. We have an online question. Tim will read it for us, and then I'll come around here with the microphone.
Okay, the online question is, what percentage of centenarians are male?
Very good question. So what percentage of centenarians are male? In most studies, about 20%. 80% are women. And again, haven't said that here yet today, but if men want to be centenarians, act more like women.
We've been trying to tell them that for years.
But are they listening? And I really mean it. I mean, we talk about health behaviors. Who are the ones who watch their weight more, men or women? Who are the ones who are exercising? I live close to Ida Hayden, and I see who's walking, because I do walk and bike there, and it's more women than men. There's some men too, there are exceptions, but who has more social support? I mean, everything that I've said, the personality, resilient personality, women always rate higher in all of those components, so we know why women live longer than men. Just men don't want to change. Okay, it seems like, even though they do, actually the gap is closing now too. But in most every study in the world, except one that I know of in Italy, in Sardinia, one of the blue zones, there it's about 50-50. We're trying to figure out why that is. It's a very unusual, different circumstance. But other than that, 80-20. Other questions?
All right. You can raise your hand if you have any questions. Maybe this time you've actually answered every question we have.
So I can't come back?
No, you absolutely, because you'll learn new things. I know that.
Yes. Well, and every time I do bring new things into my conversation.
Oh, here we go. We have a couple questions here.
This isn't really a question. It's just something I'm going to share. My mother will turn 100 in December. And last week when I was there, she asked me if she thought she would make it to 100. And I said, well, I don't know. She has macular degeneration and does not see very well, basically shadows. And she sleeps a lot unless someone's there to stimulate and talk to her. But what is so funny is that she doesn't miss bingo. And I was flabbergasted, they have these giant bingo cards that she can see. And she loves playing bingo. And she used to be a walker. She's broke bones different times. She's gotten herself back on track. And I don't know, maybe she'll make it to 100.
Yeah. So a case study of somebody almost 199, 100 in December, and she does seem to be doing well. I mean, the vision, if she has the help and the support, should not be a factor of her not making it to 100. I have not talked today much about the importance of fatigue, and you talked about her sleeping a lot. That is a critical factor of decline, unfortunately, sometimes. And when we see this first in the very old people, is that they first show levels of fatigue. And so, certainly getting your nap in and sleeping well at night, all of those are important, because we also have learned a lot about sleep and how it's the repair mechanism of our body. So when people sleep a lot, it means there's a lot more repair in cells. And it's like an old car, you need more maintenance. And so the sleep is the maintenance that you need for your particular brain. But if her general health is very good, there's a good chance. The life expectancy at 100 is about 2 years, which means half of everybody who is 100, half makes it to 102, and the other half does not. And what makes you be in the upper half? I gave you the list. If you're healthy, if you are engaged, if you're mentally healthy, if you're cognitively functioning, you're in that upper half. But in general, I can tell you that one of my colleagues and friends, centenarian researcher, demographer, reported that it is as difficult to make it from 92 to 100, 8 years, as it is to make it from 0 to 92. Think about that. It's difficult to make those last 8 years before 100 compared to 92 years before that. So that's what the demography tells us. It doesn't get easier. So I'm ready to tell you in here, but it is possible. And certainly if you compare centenarians to each other, it really is all these components that I've talked about indicate what your chances are to make it to 100. Good luck for her if she wants it.
I can't remember if you mentioned on slide number 10 about life expectancy by country. I don't remember if you mentioned what year that data was from. Either way, I am curious, and I do not mean this as a political question, but if you subtracted for death by gun violence, do you know what the life expectancy in the United States would be? Would it make a big difference?
So the question was the chart here on life expectancy, how recent is this? And then if you looked at causes of mortality in the United States in particular, and look at gun violence, how much more life expectancy could we gain? and the first question, these are very recent data, but I'm not sure that COVID is already considered in here because that's such an unusual event for most countries. It takes some time to gather data across the world. We know how it has affected us here. We've lost 1 or 2 years through COVID. If you look at African Americans in the United States, they've actually lost between 6 and 7 years just because of COVID in life expectancy. So what accounts for the decline in life expectancy other than COVID? Because I told you it started before that, and you're absolutely right, gun violence is part of it, primarily because of youth violence, gun violence. I mean, there are obviously also, as we unfortunately hear too often in the news, there are also cases where older people are affected, but most of the mortality decrease because of gun violence is among late adolescents and young adulthood, gang violence, basically. That has an effect on it. Another one, as you've seen in the news undoubtedly, is fentanyl. And just a pain medication that has led to dependency and has also had a toll. And then suicide rates have increased in the United States too. And so those three are, other than COVID, the three components that have taken our life expectancy in the United States down and have made us become now 46th in the world. But other than that, these are very recent numbers, last 2 or 3 years.
Okay, and I may have missed it, but my understanding is when you see these life expectancy charts, so if this came out this year, let's say, that means anybody born this year is expected to live to that age. For us to see what our life expectancy, we would have to go back and find the chart from the year we were born.
You're exactly right. So Vicky indicating that when we talk about life expectancy, we typically mean life expectancy at birth. So if you see new numbers, then they would refer to every baby now born in 2023. And how long can they expect to live? And again, it's 50%, which is another important aspect, because just you see that your life expectancy is 80 years doesn't mean that everybody makes it to age 80. And I hear this a lot from my friends now too, who say, oh my gosh, she died in her 60s or 70s. Much too early. No, you've outlived your life expectancy when you were born. So if you were born in 1900 and made it to 2000 as a centenarian, but if you were born in 1900, your life expectancy in the United States was 47 years. 47 years. So we've doubled that. If you were born in the 1960s or 70s, your life expectancy would be somewhere in the 60s or early 70s. So again, you're right. We often think, oh, that's my life expectancy. Well, unfortunately not. It's the life expectancy of the next generation. In which
so
case,
everybody in here has probably outlived their life expectancy.
You're all above average.
Way above. I mean, I would say you are all doing wonderfully. Yeah.
Yes.
Yeah. And I think I cut you off. I'm sorry. I thought you were done. I don't know if you had anything else you were going to.
I think I was, unless I missed the second part of the question. Then please repeat.
Okay. Tim, any other questions online?
Yes, we have one more question that just came in. Did I understand it correctly that one can turn on some of our genes? If so, how does one do it? Examples, please. And thanks.
Yes. So I think everybody heard the question. Did they hear it also on
Yes.
our remote people? So the genes turn on and turn off, or as we often call, they need to express themselves. And there's clear evidence for that, because if that wasn't the case, if you had a gene and it was bad for you, then you'd have Alzheimer's disease already at birth, right? Because you have your genes at birth. You don't. You have to live a certain, no child, or except Down syndrome, but no regular child, adolescent, or young adult has Alzheimer's disease or dementia or other genes that are responsible for diseases. So these genes do need to turn on. They just don't. They just don't. They're not just there, and you're unlucky or you're lucky. And if that is true, then the good question is, how do we keep these bad genes being turned off? And are there examples for that? Yes, one example actually comes from the cognitive literature, talking about cognitive engagement. And this is not just sort of, well, it makes some sense because Alzheimer's or dementia is a cognitive disease. But there are now studies that are showing that people who continue to challenge themselves cognitively are much more likely to keep that gene, which we now can measure, keep that gene being turned off, at least for longer, if not forever. So that is a good example of saying, challenge yourself with new tasks. Learn a new foreign language, even if you say, well, I'm never going to go to Europe, I'm done with that. So why should I learn French or German or Scandinavian Dutch? And the point is that if you use any, and there are a lot of nice technology games now that allow you to do that, makes it even fun. If you do that, you will challenge your brain, and your brain is so busy it has no time for dementia. That's the question really behind that. And there are other examples like that where this is just the beginning research. There's some other research that says, well, I work a lot with biologists too, who say, well, maybe it's one gene that prompts another gene to turn on. So it's a lot more complicated than I made it to be, because there are now obviously thousands of genes, and it is possible that all these thousands of genes interact with each other, and the right constellation needs to be there to turn on a bad behavior that you don't like to have. So it's a little bit more difficult than I made it to be, but we do have some clear evidence in the cognitive training pathway that allows you to keep a gene being turned off.
All right. Any last questions in here?
There's one up front here.
Oh, one up front. All right.
Notwithstanding the COVID crisis, is anyone interested in doing research on the people that were older that got it, that survived COVID? The people in their 90s and 100s, I keep hearing about people who just, they got over it, and they're not having any side effects, so to speak.
Yeah, very interesting. The question here is anybody interested in research to look at people who had COVID but survived it, didn't have any side effects, long-term effects? And yes, I have heard also some of the centenarians who I follow here and elsewhere make it to 100, and they survived both the flu of 1918 and then COVID. We've seen those stories in the news. Well, it's a little bit complicated. First of all, this is all very recent, so we don't know how prevalent this is. Few single case studies are always difficult to generalize from. But initially, we don't know, have these people been vaccinated or not, and how often have they been vaccinated or not. There's a lot of new factors to consider. Have they been sheltered around? So certainly one of the reasons why we closed down almost all over the world our long-term care facilities, and there's still some here where you can't get in without registering and wearing masks in town. So there's a protective role that people had, and even if you then had COVID, perhaps because you were vaccinated or because you had the medical support here in town that others might not have had. We have a fantastic expert here at Mary Greeley who dealt with COVID issues, a national leading figure who ran programs on it too. And so, the medication that is now out. So we've learned a lot. I think actually the early COVID had more casualties among centenarians. There weren't that many survivors in very old age. But as we moved on with vaccinations, with medications, with more protection, we've seen that all did make a difference. And hopefully we've now fully overcome that. But there's, when you do research and you want to publish it, unbeknownst to much of the public, and unfortunately perhaps, it takes years to get a research paper published. You don't publish this in months unless it's really something that everybody needs to know now, and maybe COVID is such a case. So the medical community did. But the thorough studies that look at many, many people over longer periods of time and look at all factors that are involved, they'll just be coming out within the next couple of years. So a little bit more patience and we'll know.
All right. Well, I think that is all the questions. So thank you so much, Dr. Martin and Dr. Brottman. excellent information, always so insightful, and appreciate your willingness to always come back. And you'll be getting an invitation again down the road. So,
If there's unanswered questions, I'll be back.
all right, we'll come up with some. Thank you for coming, everyone, today. Please fill out your evaluations. Give us ideas for other programs. You can drop those off in the back. Next week, we have another program, Wednesday, May 10th, 2 o'clock in here and online on glaucoma and its new treatments. And then we jump, over a month later to Wednesday, June 14th, we have a program on an estate planning primer. Again, 2 o'clock here, both in person and virtual. So thanks again, everyone. Have a great day. Thank you to the two of you. Thank you for joining us online.